years. We have been just kind of hoping that that patient fit the prosthesis rather than the other way around. We're not all off-the-shelf knees, right? So we sometimes need something that is going to fit us anatomically. I've been a DePuy guy for 20 years, and then I had adopted the RP. So I've been a PCL stabilized guy forever. So the aha moment came that I could actually give a more stable knee, kind of using the CR, which I'd always been concerned about. I was always worried about flexion contractures and having issues with that. With the Conformis, we see that the prosthesis really reproduces the anatomy of the knee, which I think is fantastic. Much better than any off-the-shelf I've used. That's a problem with any non-customized, is that your joint line may not replicate exactly what the patient's original joint line was. So you are going to have some ligamentous play at certain parts of the range of motion, and that's a problem. And that happens in enough people that it is a concern. With the Conformis, I'm not seeing that. It really balances the joint line and it puts it back to where it's supposed to be. And the offset polyethylene inserts really helps with that. I mean, none of us are a perfect 5, 6, 7, whatever. And the problem is we deal with, even and odd numbers when we're dealing with non-customized. There are enough people out there in the world who are doing off-the-shelf for non-customized and have a good outcome, because there are enough people out there that the prosthesis will match pretty well. But most of us are in that we're a 5.5, 4.3, whatever. The Conformis takes that out of the equation. It gives you a reproducibility in terms of restoring anatomy better than a non-customized prosthesis. And so we know that 10 to 15%, maybe even 20% of patients who have a total knee replacement have issues with pain, which sometimes is very obvious. You didn't do a good job or whatever. But there are times when you look at your x-ray and go, I did this perfectly, yet you still have pain. So you wonder, is there a soft tissue problem? And I think with Conformis, you're not worrying about the soft tissue impingement processes that can occur in a non-customized. So I think in that sense, it reduces that. So in my right hand, I have the off-the-shelf prosthesis, and on my left hand, I have the Conformis. So if you look in the back of the knee, and one of the areas where we do get soft tissue problems is that in an off-the-shelf, the distance or the width of the condyles is the same. The problem is anatomically, none of us have the same width condyle. So if I put this in somebody, there's a chance that this may fit anatomically to one condyle, but yet be either too small or too large. That can lead to soft tissue problems. The Conformis takes that into consideration with its printing, because here we'll have, this would be their condyle on one side that's medial, and then laterally you will see this offset or cutout, and the width is different. Well, this matches their anatomy. So none of us have the same symmetry. We're not symmetric in our knees. So the nice thing about the anatomic reconstruction with the Conformis is that you're matching the bone that you removed, and it matches the anatomy of the patient, and I think that's really the key thing. Most definitely. People coming in and asking for it, people having had a friend who has had it done, and now they're saying, I need my knee replaced, and you did X, Y, Z, and I'd like to talk about it. So yes, definitely an uptick in patients coming in who are asking specifically for it. It makes sense to them that, like, wow, you're going to actually make a mold that actually matches me. That's so great. That's what I say. So this is like the ultimate custom tailored suit. I mean, it's not going to fit me, it's not going to fit, your neighbor, it's only going to fit you. And so my feeling for Conformis is that if you're a high-functioning person, that's my go-to prosthesis.